My name is Gareth Flanders. I'm the professional lead for nursing within the Specialist and LD Care Group at Leeds and York Partnerships NHS Trust. What I've been asked to do is to provide an overview for you regarding barrier nursing. This information that you are about to receive are based on the trust policy, the isolation procedure IC 0009, the NMC guidance on barrier nursing, and the Leeds and York Partnerships Foundation Trust COVID-19 guidance and SOPs. What I would recommend is, in regard to the aspects of this teaching, is to refer to these documents. What you will find is that through national guidance will change, and so these documents here with mentioned will outline the current guidance that is being provided. The old adage of coughs and sneezes spread diseases. This is very much true with the COVID-19 pandemic which we are experiencing. The COVID-19 is an airborne pathogen that is due through the upper respiratory transference from sneezes from either airborne droplets or onto a surface that then is then touched by the individual and then is transferred to the mucosa, the nose or the mouth. So as this picture demonstrates, and it's the picture that we use across our COVID-19 guidance, what we're trying to do is to reduce the risk and the transfer of the virus from one area to another. As you can see within this ultraviolet light picture here, is that the virus has been transferred onto the door handle and then from the door handle onto the hand of the individual. This is very much where the virus can transfer from one individual to another through touch from a surface. So your role as a nurse and a member of staff within the Leeds and York Partnership Foundation Trust is to break this cycle. So what we have here is a diagram that's outlining the cycle of infection from one individual to another. So what we have is the infectious agent. This is the COVID-19 virus. And the reservoir is the individual. It's just transferred from one person to another. And the portal of exit is through the upper respiratory tract, through sneezing, through the generation of air droplets. So the mode of transport is through the upper mucosa, through coughing, sneezing, and touching of surfaces. The portal of entry can be through the lungs as you breathe from one person to another, the virus droplets, or through touch, which is from you touching a surface that is holding the virus and then transferring it into you through either the eyes, the nose, or through the mouth. Susceptible hosts are service users that we have within clinical areas are at an increased risk. The service users that we have within our care are a susceptible service user group. This is because they are living at the moment within a confined area. So we have a large number of people living on a ward, and so there is a lot more interaction between individuals and staff. Because of that, we need to be very careful and aware of the risks that we carry in regard to ensuring that we do not transfer the virus from one person to another. So what is barrier nursing? There are a number of terms that you will hear in regard to the adage of barrier nursing. It is also called isolation nursing or cohorting nursing. The aims of these particular terms and these activities is to prevent the spread of infection from a known person or suspected to have an infection, which can be transmitted to staff and to other patients. So as we outlined on the previous slide, your role is to break this cycle to stop transfer from one person to another. You may also hear the term cohorting or cohort nursing. This is very much of cohorting, is the practice where we reduce the risk of transmission to other patients by placing the service users or patients that have the same virus into one specific area or one clinical location. This can be either on an individual ward, where you may have a cohorted area on the ward, or even a single room that is used to where the service user or service users are placed during this period. As outlined previously, COVID-19 is an airborne, it is droplet generated, and is based on contact from one individual to another, either through the air or through the virus getting onto a surface, and then a member of staff or service user touching that surface and then transferring the virus onto themselves. There is also types of bloodborne spread that can be also managed effectively in regards to barrier nursing. This is transmission by contaminated blood or tissue, and examples for this is HIV and hepatitis B. There are also additional mechanisms that can transfer an infectious disease from one person to another, such as contamination of food, such as food poisoning, or such as water, such as Legionnaire's disease. So what is the current national guidance in regard to the provision of personal protective equipment, or PPE, that has been adopted by the Leeds and York Partnership Foundation Trust? This is based on national guidance, which is regularly updated. And again, please refer to the COVID-19 section on the StaffNet for the most up-to-date data. At the time of recording, all patient interactions that are non-aerosol generated procedures, members of staff are to wear gloves, apron, and a loop mask. All interactions with patients must take place as though they are COVID-19 positive, and this is in line with scientific evidence. Members of staff should wear gloves, apron, and a mask in all patient interactions. Members of staff are to change the gloves and apron and mask following patient interaction or when moving from one area to another. The mask should be changed following a break or eating or drinking. And for staff to remember, it is important to take regular breaks, as wearing a mask at all times can increase the risk of dehydration. Please ensure that you wash your arms as well as your hands thoroughly, in line with best practice. And this is also in line with bare below the elbow. This is in case you have any spillage droplets on your arm whilst working bare below the elbow. For a service user that is suspected, where you're waiting a swab result, or you have confirmed COVID-19 and you are carrying out an aerosol generating procedure, all members of staff should wear an FFP3 mask, gloves, a full gown, and visor. In line with national guidance, an aerosol generating procedure where this type of PPE is required is during the swabbing of a patient for suspected COVID-19, the insertion of a nasogastric tube, or taking part in a resus situation with a service user. So in regard to the provision of barrier nursing, what we are trying to do is reduce the virus from transferring from one service user to another, or from a service user to a member of staff, or from a member of staff to a service user. So the question is, how do we facilitate this? So what we have here is a list, or a proposed list, in regard to the equipment that you would have inside the service user's room or that you would have outside the service user's room. It is very important to note, as in outlined in red, the mental health of the patient may dictate that it is unsafe to leave some equipment within the room. Always undertake a risk assessment for the service user and the service users within the clinical area. So what would you have with inside the room? You would have hand cleansing facilities, gloves and apron, clinical waste bag holder and bin, a linen receptacle with a water-soluble bag, a sharps bin, any equipment that you need to have in there, such as a sphygmometer or a stethoscope, toilet and washing facilities, and outside the room you would have a ready supply of the PPE and a further hand sanitizer. So how would you facilitate these principles within your clinical setting? As outlined before, you must carry out a risk assessment on the service user or patients that you have in your clinical area and the service user themselves in regard to leaving equipment within the clinical room or outside in the corridor. Where a service user, patient or clinical area feel that it is not appropriate to leave equipment or items needed to carry out barrier nursing, this is a proposal as to what could be used or carried out. So before going into the patient's room, it is advised that the member of staff checks with the patient if there is anything else that they need whilst you're going into their room. This is to reduce anything unplanned happening within the room or you not being prepared. Collect all the equipment that you need to carry out the task that you're going to do with the service user. If you already have a set of PPE on, it is recommended that you change to a new set. Use the hand sanitizer outside the patient's room before you go in and double glove. This is the process of having 2 pairs of gloves on at any one time. You can take a mask and hand sanitizer into the patient with you, along with the Clorhex wipes to wipe the door handle on your way out. Knock on the door and ask the patient to sit down and make themselves comfortable on the bed or chair. Go into the patient's room with your tray or trolley and the equipment that you have needed to collect in order to carry out the procedure which you will be taking part in. You can offer the patient to wear a mask, and this is to reduce any air droplets through coughing. You can also ask the patient to use hand sanitizer as well. After the observation or the intervention you have carried out, put any disposable equipment into the orange bag which you have brought into the room or the sharps box, and place any reusable equipment onto the trolley, such as a sphygmometer or a stethoscope. As you leave the room, using the Chlorhexidine wipe on the door handle to open the door, you can remove, as you leave the room, the top set of gloves. As close to the patient's room as possible, or a designated room close by, clean the reusable equipment, including the sharps box, the wipes container, and the trolley thoroughly. Remove the PPE which you've been wearing whilst in the room and put on new PPE and take the clean equipment back to the clinic room. Do the planned tasks first, leave the room and work out if there's any unplanned tasks that need to be done before going back in to see the patient. If you have a service user or patient that requires investigations, treatments, or transfer to another unit, please complete the InterHealthcare Infection Control Transfer form. This enables you to document if the service user has COVID-19, the date of any swabs that have been taken, and the agreed plan of action in regard to care planning. This can be found on the discharge and transfer procedure. Should at any time you have any difficulties in isolating or manage a patient or service user who requires isolation, please contact the Infection Prevention Control team immediately for further advice and guidance. If for any particular reason the isolating or barrier nursing cannot be implemented, please document this in the patient's notes and discuss this within the MDT setting. Again, contact the Infection Prevention Control Team for advice and guidance. Leeds and York have clear guidelines in regard to the daily cleaning of isolation rooms and the terminal cleaning of isolation areas after a service user has vacated the rooms. Please refer to the trust policies relating to this. Barrier nursing can continue until you feel that this is no longer required for the service user. This is following your discussion within the MDT and with the Infection Prevention and Control Team. These will be able to provide you with guidance and assurance regarding your decision-making process. Additional points to be considered. Hand washing is vitally important, and the use of sanitizing gel entering and leaving the isolation room is of vital importance. Linen is required to be treated as infected and so needs to be placed within a red bag, either left within the isolation room if you feel that that risk is easily managed, or within a designated area on the ward. The red bag is placed in a white plastic outer laundry bag outside the infected room and applied infected linen tape if appropriate. Secure the bag of linen before removing it to the disposal room, and infected linen packs are available from Interserve. With specimens, care must be taken to ensure that no leakage occurs and that sufficient information on the specimen forms are completed. All specimens should be enclosed in appropriate plastic specimen bags as outlined within trust policy. COVID-19 is killed with the heat disinfection of all crockery, and this must be carried out. Items can be returned to the central washing up or central kitchen zone as normal and processed through industrial standard or automatic dishwasher. If you do not have access to a dishwasher within your clinical areas and are washing items by hand, liaise with the infection control team for further advice and guidance. Items that are wet on removal from the dishwasher should be allowed to air dry or to use paper towels if immediate drying is required. The use of bedpans and urinals needs to be based upon the requirement for isolation of the service user, but also based upon the dignity and privacy of all patients. Where you have an isolated bedroom that has access either to an ensuite toilet or a toilet that can be designated close by to the service user's room, then this should be used for them to use the toilet and bathroom facilities. If not, then a commode needs to be in place within the service user's room. Certain clinical areas do have access to a bedpan washer or macerator, and these should be used in a normal way. Where your clinical area doesn't have a macerator and you are having to use a commode, please refer to trust guidance on this. As outlined previously, any medical equipment that has been taken into the isolation room needs to be thoroughly cleaned. This is to reduce the risk of transference of the virus to another service user or member of staff. The provision of disposable tourniquets can be used as well, but again, it needs to be risk assessed whether this equipment should be left within the room. Any waste that is removed from the room needs to be treated as clinical waste and following the trust policy in regard to this. The provision of last officers. Staff providing this service to our service users and patients should follow the routine procedure for infection control and treat the patient as if they were alive. This is in regards to wearing of PPE and disposal of clinical waste. Additional guidance relating to end-of-life care, if this is needed, is provided within the trust policies and procedure and outlines specific guidance regarding the COVID-19 patient. Within the trust, there are links and resources you can refer to, such as the COVID-19 information on StaffNet, policies, procedures also found on StaffNet. There is a 24-hour cover from infection control advice and guidance. This can be accessed through the trust switchboard. There is also expertise within the matron, the clinical team managers and lead nurses for your clinical area. I would also advise staff with any questions to link with the on-call clinical team manager at weekends or the clinical service manager or head of operations for out of hours. I would also advise staff to read the daily comms information and update regarding the COVID-19. If you do have any questions regarding any information that has been outlined within this presentation, please contact me, Gareth Flanders, at gareth.flanders@nhs.net. Thank you.